What are the top 5 things that I ask my patients to look out for after cardiac surgery? Well, the first one is a rapid heart rate. If you develop a rapid heart rate, this could be an indicator that you've developed atrial fibrillation. This is an irregular heartbeat that requires treatment with medicines and sometimes blood thinners. The good thing about this rhythm is over time it will eradicate itself so that by 4 to 6 weeks it will be completely gone. Sometimes we have to admit you into hospital for a little electric shock, but that's very uncommon. The second thing I ask patients to look out for is fluid retention. And the first indicator of this might be that your weight is going up steadily. If you put on 2 or 3 kilograms over 2 or 3 days after you've gone home, and particularly if your ankles are swollen, then this is likely to be the case with you. And it may well be that we need to instigate a process of fluid restriction, i.e. drinking a little bit less, and adding water tablets like Frumil. Again, fortunately, over the course of time, this will become less of a problem. The third thing I ask patients to look out for is breathlessness. Breathlessness could occur because of fluid retention. It could occur because sometimes fluid collects around the lungs and may sometimes, very occasionally, need to be drained. And sometimes it can be because you've developed a chest infection. And that is often a situation where you've also got a temperature and you're coughing up some horrible muck from your lungs. Again, you need to go and see your GP or get in touch with your heart surgeon to ensure that the right treatment can be put into place. The fourth thing that I always tell patients to look out for is controlling their pain. Pain after heart surgery is not a major problem, even if you've had a breastbone break. So that if your pain is not controlled with simple painkillers, then there may be something untoward going on, and we would need to know about it. So simply call your doctor or get in touch with your heart surgeon again, and we can look into that in a bit more detail. And the last thing that I ask patients to look out for is wound infection. Wound infection usually is something where you get some discharge from the wound. It can often be painful, but not necessarily so. And if this occurs, the best thing to do is go and see your GP, get a swab, and start some antibiotics early so that we can really get on top of this. And again, if it doesn't settle down, and particularly if it's associated with a lot of pain, you need to get in touch with your heart surgeon because it may be that there's something important going on. I would like to remind you all that these complications after heart surgery are not that common. And I think of all of them, it's fluid retention that I'd ask you to look out for, because if you can control fluid retention tendency after heart surgery, your recovery will be very swift. Bye for now.